The National Drug Law Enforcement Agency, NDLEA, says all is set for the hosting of its 31st meeting of heads of drug law enforcement agencies, ONLAF. The meeting will bring together heads of drug law enforcement agencies from 53 countries in Africa to discuss the relevant strategies to combat drug trafficking and abuse in the continent. Briefing newsmen in Abuja, the NDLEA Chief Executive Officer, Brigadier General Mohamed Buba Marwa, retired, said the meeting is an indication of trust in the leadership qualities of the NDLEA amongst its peers on the continent. Our correspondent, HONLAF, completes the report.
The 31st meeting of heads of drug law enforcement agencies, ONLAF, which will be declared open by President Bola Tinubu, will feature paper presentations, deliberations on reports and trends, bilateral talks among member nations. The NDLEA Executive Officer, Brigadier General Buba Marwa, retired, who was represented by the Secretary of the agency, Barrister Shedrack Haruna, said the meeting will serve as a platform for brokering collaborations in the area of shared intelligence, joint training against international drug cartels.
It is a platform for brokering collaborations in the areas of shared intelligence, joint training, and joint operations against international drug cartels in the African region. This year, Nigeria has the honor of being the chair and host of the meeting. So it means delegates from 53 other African countries who converge on the Federal Capital Territory, Abuja, on Monday. And for the rest of the week, there will be the guest of NDLEA and the federal government of Nigeria. Aside from delegates from African countries, there will be representatives from observer bodies and other non-African countries who will be attending the conference.
Speaking, the United Nations Office on Drugs and Crime, UNODC, country representative Oliver Stolpe is confident that issues that will be discussed would help in reducing cultivation and production of illicit drugs in the continent.
We are confident that a large crowd will descend on Abuja and make this meeting utmost useful. Utmost useful, of course, one, already because of the substantive significance of the topics that will be discussed, most notably regional and international cooperation to reduce illicit cultivation and production of drugs, something that we have observed thanks to the operational successes of NDLEA.
The HONLAF meeting is an annual event. The last meeting was held in Nairobi, Kenya, where Nigeria was unanimously elected as the host of this year's edition. Awesome Raffle, ADBN News.
Medical Women's Association of Nigeria, MWAN, has called for adequate budget allocations for private and public health institutions in the country. The national president of the association, Professor Rosemary Ogu, made the call at a press briefing as part of the communique issued at the end of the 23rd biannual conference of the association held in Port Harcourt, Rivers State. ADBN TV correspondent completes the report.
The newly elected national president of Medical Women Association of Nigeria, Professor Rosemary Ogu, however, urged government to allocate more funds to the health sector so as to address the problem of low-quality healthcare and eventually curb medical tourism in the country. Professor Ogu called on government to prioritize the welfare of doctors in order to fight against brain drain and continuous training and retraining of healthcare workers by government at all levels so as to develop their human capital development, skills, and develop robust healthcare in the country.
Government should ensure adequate sustainable provisions and access to quality healthcare at all levels and improve welfare of healthcare workers in order to curb medical tourism and brain drain. We can reverse our brain drain into brain healing. That the current state of private and public health services should be compared with global practices and that funding is the perennial issue plaguing our health system. Therefore, adequate budgetary allocation and private-public partnership is proposed as a viable option to tackle the funding sustainability issue. Patient-centered care, improved referral systems, and tax shifting approach with multi-specialty collaboration was advocated for quality, affordable, and accessible healthcare.
Professor Ogo, while advocating for inclusion of women in leadership positions in the political circle and workplaces, she emphasized that leadership positions of health practitioners should be based on merit.
Interprofessional rivalry was observed as a hindrance towards effective healthcare delivery. The conference proposed a system of continuous training of doctors as managers in healthcare sector and encouraged integrity, transparency, accountability, and discipline in all healthcare workers. Training to encourage harmonious working relationships between doctors and other health workers should be integrated into the medical nursing school curriculum. The conference observed that there is historic discrimination against women in terms of employment, promotion, research opportunities, and leadership positions. Women have great potentials to make lasting impacts in the society. Therefore, strong efforts should be made to stop such discrimination against women, and policies should be entrenched which ensures fairness and equity for women. We're calling for meritocracy in the appointments, in promotions. Women can do it. We don't need a lowered standard. But we know that there's discrimination. Because you're a woman, you don't get to the top.
The national president of the Medical Women Association also charged government at all levels to rise up to her challenge in making sure medical practitioners are secured and call for release of their colleagues in captivity.